Biomarkers and outcomes of COVID-19 hospitalizations. Systematic review and meta-analysis. COVID-19 is rapidly spreading global pandemic with increased burden on healthcare. Few observational studies have described association between different biomarkers with severe outcomes. Laboratory biomarkers are less expensive, faster and easier to obtain, and preferred modality to monitor and predict outcomes and prognosis of disease. The objective of the study is to evaluate association between biomarkers and outcomes in COVID-19 hospitalized patients. We have performed a systematic review and meta-analysis. English full-text observational studies describing the laboratory findings and outcomes of COVID-19 hospitalized patients were identified following MOOS guidelines. Studies having biomarkers, including lymphocyte, platelets, D-dimer, lactate dehydrogenase, C-reactive protein, aspartate aminotransferase, alanine aminotransferase, creatinine, precalcitonin, and creatine kinase, and describing outcomes were selected with the consensus of 3 independent reviewers. Composite poor outcomes like intensive care unit admission, oxygen saturation less than 90%, invasive mechanical ventilation utilization, severe disease, in-hospital admission and mortality were included. The odds ratio 95% confidence interval were obtained and forest plots were created using random effects models. Publication bias and heterogeneity were assessed by sensitivity analysis. 32 studies with 10,491 confirmed COVID-19 patients were included. We found that lymphopenia, thrombocytopenia, elevated D-dimer, elevated C-reactive protein, elevated precalcitonin, elevated creatine kinase, elevated aspartate aminotransferase, elevated alanine aminotransferase, elevated creatinine, and elevated LDH were independently associated with higher risk of poor outcomes. Our study found a significant association between lymphopenia, thrombocytopenia, and elevated levels of CRP, PCT, LDH, D-dimer and COVID-19 severity. The results have the potential to be used as an early biomarker to improve the management of COVID-19 patients by identification of high-risk patients and appropriate allocation of healthcare resources in the pandemic. For more details, below is the link for this interesting study. Please review it. Follow us for more videos related to research interpretation.